Goeiedag, good day, fellow South Africans and citizens of the world. And now we have empirical proof that the lockdown in South Africa has failed. And we know this because there's no social distancing, so why bother? You know, you look at the townships, look at the taxis, look at so many different areas where there's no social distancing. And of course, what's happening is that it's now infecting you've got clusters just spreading all over the place. And why am I saying this? Well, remember, it's 21 days now since South Africa started its lockdown. So at this stage, the number of infections should be actually going down because of that extended period. This is a big if they had been competent in their testing, which they haven't been. So what's happening now is that clearly the graph is going the other way. Instead of tapering off because of the lockdown, which Ramaphosa keeps on saying, we got to keep the pressure on, well, that little valve is bust, is going all the social distancing being broken. But you got to have a bit of this L stuff to actually work that out, and unfortunately it's missing in action. Now, let me tell you what's going on here. South Africa has reported a record number of new COVID-19 infections as it steps up screening and testing. Health Minister Zweli Mkhize announced on Saturday night. The tally now stands at 3,034 cases, an additional 251 on the number recorded on Friday. The previous record of new cases was 243 nearly a month ago on March the 27th. Gauteng remains the province hardest hit with 1,101 cases, followed by the Western Cape, which has 836, and KwaZulu-Natal with 604. The Eastern Cape has 270 cases, with Free State 100, Limpopo 26, Northwest 24, and Mpumalanga 25, Northern Cape 16, and 32 cases have yet to be allocated, said the minister. You know what they say when they've yet to be allocated? Those people are not identified. They don't know who they are. The documentation has been completed by an idiot who doesn't know what they're doing. So you've got 32 people wandering around there who are actually COVID positive, probably in townships, infecting a whole lot more people. And they're only the tip of the iceberg. There are a lot of other people like that happening right now in South Africa. COVID-19 is a highly contagious respiratory disease that has raced around the globe since it first emerged in China in late December. By Saturday, it had sickened more than 2.29 million people and caused more than 157,000 deaths, according to the Johns Hopkins University tracker. The number of confirmed cases in South Africa remains low relative to many hard-hit countries in Europe and the US, but are to some a reflection of the extent of community testing, which only got underway in earnest shortly before Easter. A total of 108,021 people have been tested for COVID-19 since the disease was first detected in South Africa in early March. That's a pittance. Think about it. That's about 50 days. That's about 2,000 tests per day with a population of 55 million. It's a joke. I don't know why they bother. I really don't know why they bother. This is not accurate information, and we'll get to that in a second. The majority of tests were initially conducted in the private sector, but the state has rapidly scaled up testing capacity in the past month. Mkhize said close to 900,000 people had been screened and 11,000 referred for testing since the government began deploying field workers into communities shortly before Easter. He said the government was making steady progress in expanding testing, but needed to scale up further. Now, this is the really interesting piece of fake news. And this is what happens when you censor the news, okay? This is an article in IOL. And it says, South Africa ranks second in the world for reliable COVID-19 news. Guess why? Because the South African mainstream media have been censored by the ANC government. They can only present what they are given, even if they know the information is incorrect. Here on this channel, which is based in Australia, we present the facts, not the fake ANC crap. But this is what the mainstream media are about. This article says, the spread of fake news is a crisis in itself, and forced COVID-19 posts on social media have caused mass panic both locally and internationally. There has been a flood of fake news posts shared on various platforms, from WhatsApp to Facebook and Twitter. But South African lockdown regulations have made it more difficult by criminalizing the dissemination of misinformation and fake or misleading news reports. Anyone caught spreading fake news could be fined or imprisoned for up to 6 months. According to COVID-19's Epidemics Observatory, South Africa ranks second after Singapore for the most reliable COVID-19 related news and information. Now, I'm calling that out as BS. Let me tell you something. America, Australia, just two countries, their information is spot on, and they are not censoring people from actually challenging the information. So this article in itself, and it's an IOL, is fake news. I'm calling it out as fake. All right, guys, please remember to subscribe to be kept informed. Ring the bell for the updates. Please like this video. Please share this video. And above all, please stay safe.